I'm Ayman.
I'm Sonia.
And I'm Kate, and today we're dishing with you from the Lebanese Taverna, located at 7141 Arlington Road in Bethesda, Maryland.
One of the many Lebanese tavernas.
That's right, they're celebrating their 30th year this year.
Really?
30 years of this fabulous food.
So we should just follow the smell of chickpeas to our favorite Lebanese taverna location.
But you know what? They don't seem 30. And none of the people that you deal with seem 30, right?
Absolutely not.
Absolutely not. Because Dr. Ayman Hakki is a celebrity plastic surgeon in the area. And are you allowed to tell us some of the people that you've worked with? Do they let you?
Not really.
And we should really not know the people you've worked with. We should never be like Nicole Kidman.
Ooh, have you worked with Nicole Kidman?
Never,
Hopefully not,
ever,
because that is some bad advertising.
I do not plan to work on Nicole either.
Would you agree that
I literally, it's funny you mentioned Nicole Kidman because I literally mention her name at least once a week.
For
When
good or
people-
bad?
When
Why?
people come and they want to have Botox, I always tell them, I could do everywhere, your whole forehead, but then you'd get what I call the Nicole Kidman look, which is this look like this, where you go like that, and you're smiling, and you don't move.
Right, it's sort of like going to...
And that's the opposite of the look I want. I want you to be able to move your brows on the sides, even if it means a few lines, without moving your frown. The idea is to make you look like you're not scowling, but it's not to make you look
like
frozen.
more natural, and so not as
Exactly.
if everyone can tell that you actually had Botox.
Exactly.
No.
No one should know.
I wanted you to do Botox on me, on camera, but we don't have the time for that, so you'll just have to tune into another show. When
Imagine that it's happening.
Imagine, but speaking of Botox and the lines, I don't have too much lines here yet.
No, you don't.
Well, I have a couple, but I make this face a lot when I'm driving, when I'm angry, when I'm just like being.
When I'm thinking really hard.
Yeah,
Road
anytime.
rage.
This is more of like the relaxing face for me. So would Botox sort of mitigate that, like get ahead of it?
Not only will Botox get ahead of it, but actually there's been some new studies that prove that it actually goes into your bloodstream and goes to these certain cells in your brain that produce hormones that make you depressed and anxious.
This is kind of
So
scaring me,
I think
actually.
honestly it's the most addictive substance known to womankind.
And is that a good thing or a bad thing?
No, it's a great thing because I've had patients myself that I've been putting Botox in them every 4 months for the last 11, 12 years. We haven't found anything wrong with it. And more importantly is when I first was introduced to this product, my wife brought to me this video from Paris because at that time it wasn't even available in America. And she showed me and proved to me beyond a shadow of a doubt that Botox had been used for 20 years by eye doctors to relieve a very specific condition called blepharospasm, where the eyes were all spasmodic and people couldn't open their eyes. So we didn't really do any of the research as plastic surgeons on this issue. This research had already been done and proven to be safe by the ophthalmologists or the eye doctors way before we even started doing it. We just started using it on what's called off-label for the treatment of wrinkles. So I think that there's a very long history that proves that it's safe, effective, and doesn't have any long-term effects. But at the same time, I mean, I'll be honest with you, my wife brought it to me from Paris. I said, no way, I'm not going to inject you with a toxin.
Well, we talk about Botox, I think, because a lot of people are into it and are thinking about it and getting it done, but this is not the only thing that you do. Maybe it's the most frequent thing that you do. But what is actually the most frequent thing that people come to you for?
I think that there was a time when Botox was the procedure that was being the most. But right now, I could honestly say that fillers have truly
Fillers.
where
Everybody wants to have lips like me.
These kinds of fillers?
Yeah.
fillers of the lips, fillers of the face,
Yeah.
fillers of areas that you wouldn't even expect
So, like-
needed to be filled.
Oh,
I'll give you a really perfect example. You're a very handsome man.
You are.
But
It's about time.
there's always a
But there's a but.
But
I'm allowed to pick on men, right?
and women, that's fine. If you tell me what's wrong.
But you do have a little lack of volume here and here. If you had a little more fullness right there, do you see that? You would look like those male models that you see all the time.
I'm this close.
You're that close.
You're that close, seriously, I'm not kidding. And fillers, especially your own body, like taking your own fat cells and treating them in a certain way and allowing them to settle, not only gives you more fat, or which is volume, but it also gives you stem cells, which we didn't even know we're doing. So it actually reproduces skin, bone, fascia, muscle, everything.
It
all
looks
the
more
layers.
natural probably too.
You cannot possibly know that I had that operation, and I did.
Did you?
I had this
Did you
area
do it to
here.
yourself?
I have a team,
Okay.
and I have friends who came to me in my own office and helped me do it, and it's such a safe, easy procedure. It does require anesthesia, but the beauty of it is that if you look at me really carefully, you don't see what I had done.
No.
But if you saw my before, and how I was started, because I lost a lot of weight, how I was so hollow here, you'd understand.
So do you see that happening with men? Because now we've been talking about women who have a lot of Botox or wrestling or anything else. But do you see men coming to you and having different works, for example, this or even Botox for the frowns? The
American Society of Plastic Surgery's statistics show, without a doubt, that there's a higher increase. There's a very, very large increase. Men are the largest group of people who are getting more and more cosmetic procedure. But I don't see it in my practice. I think I love women too much and they love me too much that I don't have a lot of men in my practice. I don't know what it is.
Well, you did. Why did you choose to locate your practice in the Washington, D.C. area? Are there a lot of people here that are concerned about cosmetic surgery and the way they look and are coming to you? Or this is
I
just...
thought she was going to say, are there a lot of ugly people in town?
Well, are there a lot of ugly people in town, or are you just from here and you decided you wanted to maintain your hometown boy
I
status?
hate to be politically incorrect, but all the ugly people are in Congress. I think Washington
really
is
like you. You're
full
just
of
gonna
beautiful people. And I think Washington is full of beautiful people, and it was a dream of mine to come to Washington because I grew up in Washington. I literally went to Merch, which is right off of Connecticut Avenue, you know.
You're from Washington.
Northwest, south of Chevy Chase, near the Uptown Theater. And all my life I've wanted to come back to Washington, and when I got into Georgetown as a resident, that was like a dream come true. So, and this was like 25 years ago. So I've always loved Washington. I've loved the fact that Washington is sort of like, it's like a third world country in the middle of America. and I love the people here. I love the diversity. I love the challenges that treating different ethnic groups present to me as a cosmetic surgeon. I love the fact that I wouldn't treat your mid-face like I would treat your mid-face. I wouldn't treat you like I treat me or somebody else. I think that just makes it so much fun to have a different palette of people to work on with the same goal, which is you want to make them look less tired. You want to make them look less haggard. But more importantly, you don't want anyone to know that they've had anything done. If somebody can tell that I did something on you, then I have failed.
Well, if you're interested in plastic surgery, which it seems like all of us are going to need it because you need your face filled and
I
you
have a
want
whole bunch of
Botox
problems.
and who knows, there's all kinds of things we could work on over here. We'll have to come and check you out. Your new location in Waldorf is amazing, and rumor has it you're opening in DC soon, so we'll keep our fingers crossed, and you'll have to let the dish know first about that.
I will definitely let you know, and it's a pleasure being with the three of you.
Nice to meet you as well.
It really is.
If you're looking to have that done, make sure you check out Dr. Ayman Hakki, and as always, check us out here on this next episode of The District Dish.